It is just a huge honor for me today to be podcast interviewing Dr. Billie Rachel Zoldan, DDS, an orthodontist that lives and practices in New York City. She is passionate about orthodontics, has high-volume offices where she treats patients with traditional braces and appliances, as well as clear aligners. She is also one of the select orthodontists for Candid Company, which is a direct-to-consumer clear aligner product. She would love to see orthodontics become available and affordable for more people. She's went to Cornell University, graduate 2005. Then she did her ortho residency at NYU College of Dentistry. On her free time, her and her husband, Dani, are busy with their 3 children, ages 12, 9, and 5, and she loves New York City and all it has to offer. My gosh, thank you so much for coming on the show today. What I love the most about you is your, the older dentists, when they saw any form of competition, they're just like, bad, all competition bad. They don't want anything new. And when I read 5,000 years of history, I only see 2 things. You need to be transparent. Don't be opaque. If no one knows what you're doing, it's usually not good. And you need competition. Absolute power corrupts absolutely. We got rid of kings and queens and broke up the king into executive, legislative, judicial. And in Arizona, I practiced for 32 years. And before there were DSOs, if you fell off your bike, if one of your kids fell off their bike and broke off their front tooth, you'd find 3 unicorns riding a mermaid before you found a dental office open. And now, because of competition, there's 7 to 7, 7 days a week. So I love competition. I love high tech, and I think do-it-yourself consumer braces is going to make the old orthodontists, like as old as me, have to rethink everything they've done. So what made you open-minded enough to be bright-eyed and bushy-tailed to say, hey, I know all the old orthodontists say this is evil, but I'm going to look into it. What made you have an open mind to look into something like Candid? I'm sure an old orthodontist didn't recommend it to you.
No, so I'll tell you. In fact, I was at like an ortho conference or like an alumni event, and somebody was lecturing, and then all of a sudden they got up and they started to get really angry. And I'm like, what is he getting so upset about? Like, I couldn't figure it out. And I turned to my friends. I'm like, is he getting upset at Smile Direct? Like, this was like a call to action. And I look at my friends who are orthodontists. I'm like, I'm not really upset about that. Are you guys? Like, I don't see it as competition necessarily. Like, those are not my cases. Those are not the people I treat. I don't know why they're getting so upset. So from the get-go, I didn't really see something like Smile Direct to be something that I'm concerned about. So that was my perspective from the get-go. Maybe I'm not like the other orthodontists, but I do have other orthodontic friends that are similar in ideas to me. And then the way that Candid came about is kind of funny. I was just like scrolling through Instagram at some point, and I saw this company that, when you go through Instagram, it shows you things you might be interested in. So this was like a dental advertisement, basically. So when I looked through their feed, it just looked really cool. Like, something about their company was like catching my eye. And I've never done it before, but I messaged the company saying, your company looks cool. I'm an orthodontist. I would love to be involved. That was it. And then that same day, I went out to dinner with my husband, and he has a podcast, and he was showing me his upcoming shows, like who he's interviewing and what it's going to be, who they're going to be. And one of them, he goes down the list and he's like, CEO of Candid. I'm like, you're interviewing the CEO of Candid? How do you know them? And he's like, well, how do you know them? And he's like, well, I'm going to interview them in the next 2 weeks. You'll just come on the show. So I went on and I met the CEO, Nick, from Candid, and that was it. And he was talking to me about it. And I didn't get involved right away, but, I kept in communication, and then I became one of their orthodontists. And before I became really involved, I guess I spoke to my dad, who's a lawyer, and he gave me every reason not to do it, like all the risk, all this. And then my husband and I were like, well, if you don't do it, then you don't really know, right? Like, then you just won't be part of whatever this is going to be. And I just jumped in, and I figured, you know what? Like, I could always just stop. Like, that's it, right? And it's been a really good opportunity so far.
So your husband was brave enough to marry a woman whose dad was an attorney? Oh
Yes.
my gosh. Was he drinking at the wedding, or did he know what he was getting into?
I don't know. I don't
My
know.
God, that's a brave man. Well, the way I look at it is I don't think I've ever had an original idea in my life. I mean, I'm a dentist. Guess who else was a dentist? My next door neighbor, Kenny Anderson. I literally went one house down to find my profession. God only knows what was two houses down. Maybe he was a plumber or something. I always think that, the news covers all the publicly traded companies, which is about 15% of the economy, and the small business like Ortho, your husband, your dad, the lawyer, that's 85%. And I look at these big guys as things to steal from. And I noticed when I was out here in Phoenix that when Smiles Direct Club, initially they started opening up some of their own stores. And then they got into some trouble with someone else. There was a lawsuit. They had to close them down or whatever. But I noticed the really smart guys, the really smart orthodontists, they immediately went down there, tried to see what they were doing, and they started rethinking their deal. Well, maybe I don't have to see you every month for 24 months, or maybe I can do this. And then another thing they were doing is they built a relationship with them. So the cases that were rejected, they immediately started sending them to the one nice orthodontist who drove down there and was all pleasant and nice. So he was, I mean, we can learn. There's only 3 publicly traded dental DSOs in the world. There's none in America. There's 2 in Australia, 1-300 Smiles and Pacific Smiles. And then there's one out of Singapore, Q&M. And I went to Australia and Singapore just to podcast them and found out they all had the exact same business model. They were all open 7 to 7, 7 days a week. I mean, they all had the exact same thoughts. And I thought, okay, well, here's the playbook of obviousness, you know what I mean? So how could Smiles Direct Club, and by the way, do you call it Candid Company or Candid Co or Candid?
So they call it Candid Co, or I just call it Candid. Candid and Co, they call it, but Candid is fine.
But Nick calls it Candid and Co?
I think so. I say Candid when I'm talking to like anyone in their company, and they're fine with that.
And your husband was interviewing Nick for his podcast. Is your husband a dentist?
No. I'm in his comedy club. You see where he has a club, and he's an entrepreneur. So he just likes to interview other entrepreneurs, people with interesting ideas. So Nick was on his podcast because he had this cool idea that he really built up.
Who's that New York dentist, older guy, long white hair?
Yeah, I know exactly who it is.
Comedian.
I met him. I mean, he's a comedian also. Yeah.
Yeah.
I forgot what his name is.
I don't know if you know this, but that was always my hobby. I've been doing stand up ever since.
Oh, really?
I've done. I mean, I got.
Well, now you have to visit. You see what's going on.
Oh my gosh! But I was a big fan of that dentist there, that interviewing guy. But I loved it because And then after a while, I thought to myself, well, you know what? I'm kind of like a dental assistant who says they're a dentist. I never got formally trained. So the Phoenix had an art center, and they had this guy, Tony, and he had a comedy school that was 3 nights a week for 6 weeks. And then he also taught improv and us. But I went through the program, and it was so neat because I had come up with a lot of these concepts, but I didn't have the fancy words for them. You know what I mean?
Mm-hmm.
And like I used to call it a hook, like lead them this way. Then the last word, hook them right. And then you learn the way they formally teach you, like, with less words, you describe a red ball. And then the perfect joke is the last word is a pen. You pop the red ball and they see it's blue, and it's an involuntary laugh. And I just loved it. And I took the improv too, because I think that, again, the average American buys a $33,000 car every 5 years. They'll buy 13 cars in their lifetime. And the dentists that sell all those cases are about 5%, because 95% of the dentists can never present you a $35,000 case. They just point to the worst tooth. And I've told so many dentists, I said, you know what? You did your job. You stayed in the library for 8 years, and you mastered sine, cosine, tangent, and you know everything about geometry and calculus. But dude, you can't talk to people. And
right.
I told him, go do stand-up. I love stand-up the most because a movie star. I mean, hell, a lot of times they'll take 30 takes for one line. I mean, that's
Right.
lame. A comedian, and I don't like Carrot Top because he ruins everything with props. That's not a comedian. And that little puppet guy, those should be outlawed. And I loved comedy because you walk out there, it's just you and the audience. And the dentist that and a comedian, you get 3 bombs in a row, you're gone off the
done.
stage. And I can't tell you how many times I walked on the stage where the person walking off the stage was crying and losing it and falling apart and all that kind of stuff like that. And you need to bomb and you need to fail, because when you walk in that room, just like a comedian, you walk in there, and I've seen so many dentists, they walk in the room, the first thing they do is they look at the bite wings on their radiograph and say, you have an MO on number 3 and you have a DO on number 4 and there's an MOD on number 5. And it's like, dude, what the hell are you doing? You're a freaking alien. You got 3 jokes and you're dead. And you walk in there and you make eye contact and you shake their hand and you ask them about them. And if you can do 1, 2, 3 good jokes in a row, she likes you, she trusts you, you're selling the invisible. If I told your husband he has 4 cavities, what's he supposed to do? Google it? He don't know. He's got to trust me and my facility and everything. And I love comedy. I love stand-up. It's the purest art form there is. Tell your husband, good for him. I just love it. And nothing is off topics. If you can't laugh about something, I mean, what the hell's going on? In fact, I purposely went out of my way the day Joan Rivers died. I can't remember her saying that, it's not too soon, and she'd pile on someone who just had a tragedy. And man, when Joan Rivers died, I was like, all day, it's like, it's not too soon. It's Joan Rivers. She would want the pile on right now. But that's so cool. So what have you, you always first hear the extremist stuff. Like now there's all these clear aligner orthodontists who are saying that they only use clear aligner. And I'm like, come on, dude, really? There's 8 billion people and no one needs a wire and a bracket because of Invisalign. So what did Candid do for you? If you saw 100 patients, how many of them get the old-fashioned metal wires? How many get clear aligners? And if they get clear aligners, how many are getting Candid or Invisalign? I'm not an orthodontist, so
okay.
Educate me.
My Candid work is separate, obviously, from like my private practice because they're cases that they streamline to me. I don't see the patients. It's all virtual. So that's separate. Those patients are ones that have already gone to Candid. They've gone through their, their filtering, like to make sure that they're eligible for whatever Candid is. Candid is limited treatment. It's not full treatment. So I would say that the ones that I treat with Invisalign are not necessarily the ones that would get clear aligners in Candid. You know what I'm saying? Like if I have a complicated case in the office where I use clear aligners, that's not necessarily going to be a Candid case. So the clear aligners are used for all different things. I do still do a lot of braces. I do a lot of appliances. Can I do more things with clear aligners than I ever could? For sure. And maybe I could even go completely to clear aligners or close to it, but not quite yet because there are kids who are not compliant and there are teeth that are still erupting. So those few things are still factors that are taken into clear aligners. But I think we're getting there. The one thing I think is that the holdback is that insurance doesn't really cover the clear aligners. When I say insurance, I'm discussing like Medicaid, things like that. So those are traditional braces.
And is Candid is that publicly traded or is that still
no, it's not.
It's not publicly traded yet?
No.
Well, call your dad real quick and ask him if you can tell our viewers today if Invisalign stock is a buy. I mean, it's at 571, and I think it's it's twice as high. I mean, God, just in the last year, it's gone from oh my gosh, 144 to 571. And the trading volume is going down. I mean, to me, it just reeks of a total bubble. I mean, I've lived through 4 contractions. This looks like the 98. I graduated in '87. That was Black Thursday in October. Then the Y2K, and then the Lehman's Day, August 15, 2008. But does this? I mean, to see Invisalign Align Technology trading at 571, I'm thinking to myself, man, we are completely in bubble territory. But Candid's not. Candid and Co. What did you say? You called it Candid, but they called it Candid and Co.
Yeah, if you
Candid
look it up, like if it's candidandco.com.
It's still private equity, venture capital. It's not publicly traded or anything like that. First of all, I want to back up a little bit. A quarter of our viewers are still stuck and stranded in dental kindergarten school, and they haven't graduated last year. And a lot of I hear a lot of chatter among the dental students, especially ones out here at AT Still and in Midwestern, saying, "Well, ortho. I mean, they're getting competition from publicly traded companies like Align and do-it-yourself like deal, and they're saying is if they were young." Do you think orthodontics as a specialist is under so much more competition that maybe they should look at the other specialties like oral surgery, endo, perio, ped, pros, oral facial pain, oral med, oral path, oral radiology? Or do you still think orthodontics as a profession, as a specialty, is a buy and hold?
Right. So the thing is that I think you have to love whatever it is. So if you really love orthodontics, I would say go into it. I don't know where it's going really. Like when I went to dental school, which is now a lot of years ago, maybe like 12 years ago or something like that, the same thing. Invisalign is going to take away, orthodontics. And I still went to residency and they still haven't done that. I'm not sure if those patients who are doing things like Candid and Smile Direct were ever coming into my office. Maybe those are the people that were never going to get treatment. Maybe it was always out of their ability to afford it before those kinds of things. So I don't necessarily think that it's going to wipe out the orthodontists. Also, remember, Candid has orthodontists behind them. So they do need orthodontists to do their treatment planning. Other companies may not use orthodontists for that, but they do. So that's an important thing to remember. And then you have my office that's filled with patients that still get braces and have appliances like, expanders and all those other things that we do.
So if you're in dental kindergarten school, you might not have understood. What is it you're saying is the difference between a Candid & Co case and a case that comes into your office?
So the Candid & Co cases are limited treatment almost, like somebody who has a little space in the front that they want to close, a little bit of crowding. The limitations are probably a little bit wider than let's say, like I remember in dental school, there was like an undergrad case was like, 4 millimeters of crowding and this and that. It's probably a little bit more than that, but it's limited. Like, let's say somebody has a big open bite and they're not interested in closing the open bite, but just to close that little bit of space between their front teeth, they could do that through Candid. There is overlap, and there's going to be overlap. Like the teenagers who now want to get treatment for the first time, they would always go to the orthodontist. Now they might start going to Candid. But again, those aren't like skeletal corrections, anything like that, or surgical cases. Nothing like that is going to be done. There's no rubber bands. Maybe there will be in the future. I don't know what's going to happen.
Well, the way I see it, I turned 59 this year. When I was little, I was born in 62. And when I grew up, all these big Catholic families in Kansas that had my mom and dad had 7 kids. It was only the worst child got ortho. I mean, it was the one who could, eat a ham sandwich to a chain link fence. I mean, the one that could never ever attract a mate and mix gametes and reproduce got ortho. And then after 1945, the number of kids went from, like over 5 per family to down to 2, and they waited 10 years before they started having babies. And so now it seems like everybody gets ortho. I mean, you only have 2 kids, and a lot of them are mild. A lot of them, and I believe that ortho and implants, they're the only 2 sections of the dental global macroeconomics of dentistry. You know, there's a dentistry in the United States is about 110 trillion a year. It's about 500 billion or half a trillion globally with 2 million dentists. And implants and clear aligners are the only things growing double digit. Everything else is growing just a little faster than the rate of inflation of the country. And I believe it's all the pretty as a peacock effect. I mean, your only goal as a species is to reproduce and have offspring, too, that when you drop dead, you left someone standing. That's your only goal. So they're all trying to go out and look as pretty as a peacock to attract another primate to hook up. And I see the same thing in implants. The biggest error in implants is people think that they ask you, well, do you have any problems chewing? Dude, that's not why they're getting implants. They're getting implants because they got a face right there, and you can't go to the comedy club and get a date if you're missing a bicuspid. And I see the braces going from just the worst child, in the 60s and 70s, to now it's both children. And then after their first divorce, they'll come back in and get some bleaching, and they'll get Invisalign again. And then when they retire and move to Arizona, I don't know if you know this, if you've ever lived in a big retirement community like Phoenix or Florida, but when they lose their spouse, they're lonely, so they move from Minnesota and Canada, and they come down here to Phoenix, and they get braces and bleaching and veneers, and they're 80 years old, and they're looking for another primate. In fact, this is so embarrassing and inappropriate to say, but Arizona is the only state where the number one broken bone each year in Arizona is a rib, and it's from old people doing what. I mean, so I think that they're going to want to look as pretty as a peacock. I think the long-term trend for clear aligners is just off the charts. I think 100 years from now, 8 billion people will probably get clear aligners 3 times in their life, because that's how important your smile is. And this pandemic has really been a boost.
I was going
to
say that was one of the biggest boosts, was the Zoom calls and the video calls. I think that was the biggest reason why all of a sudden clear aligners has shot up. Everyone's looking at their screen all the time, and everyone sees their own teeth.
See, I thought it was the opposite. I thought it was, now that everyone's wearing a mask, people are realizing, oh my God, I don't even know if you're smiling or mad or, I think when you took away the smile, everybody's realizing, God dang, that I need to see your teeth and smile and lips, and I need to see that. I can't just do the eye thing. But you're saying they're staring into Zoom calls and saying,
yes. And in New York City, I've heard that even the plastic surgeons have been doing tons of work, because people are staring at themselves all day long on video, and you start to notice everything and the things that bother you. And also, I even have patients who are doing clear aligners now because they're wearing the masks. So they're like, it doesn't bother me if something's in my mouth because I'm wearing the mask outside. And then their teeth are fixed for their Zoom calls.
Yeah, and I just want to say, for full disclosure, I have not had any cosmetic surgery. I don't take steroids. Everybody always accuses me of that, and it's just not true. But you said something really profound, which reminds me of the quote, what if she wants to be an orthodontist? Well, if you do what you love, you'll never work another day in your life. And I broke my dad's heart because I didn't follow him into Sonic Drive-In, and I followed my neighbor Kenny into dentistry. And I said, Dad, I'm not going to make foot-long chili cheese dogs for 40 years. I mean, it's not me. I could eat them for 40 years, but it's just not me. So you got to do what you love. And then you did something I did too. I was in Kansas. You didn't have a dental school. And so I went to Creighton because it had a dental school and had undergraduate preference. And you chose NYU because you already knew you wanted to be an orthodontist, and they had an orthodontic program. So, that's really good advice. I mean, I saw kids that went to K-State and KU and Kansas Newman, and they were begging at the mercy trying to get into these other schools. And I was at Creighton. I had undergraduate preference. I got in after 3 years because I already gone there for 3 years. So is that what you recommend, that if you want to be a specialty, go to a dental school that has the specialty school?
I don't know. The one thing that I knew was that they had an honors program. So I figured if I could go to a school that has an honors program, that means that they're kind of encouraging to go to the next, which they say that they don't like to accept their own, which all the schools will tell you because they want other students. But once you get into the honors program, then you automatically get an interview with their program, obviously, and because you're an NYU student. So to me, that sounded great. I don't know if if that's the answer for everybody, because I don't know how the other dental schools work necessarily. But I wouldn't give up. Like if somebody wants to be an orthodontist and they don't get in on the first try, I would try again. I went straight through, but a lot of my co-residents didn't, and it's totally fine. So that's my advice.
So, I love it when people trip and fall down, because I just want to see, Japan is a 9,000-year-old civilization, and their big saying is successful man fall down 7 times, get up 8. And I just love it when someone's plan doesn't work out, just to see what their reaction was. And I've seen dentists not get accepted in a specialty school and immediately double down and say, well, I'll go to the Dominican Republic, I'll go to Grenada. And I've been doing this 32 years, so I've already seen them graduate, come back, they apply for their license. The State Board of Dental Examiners doesn't care, and these are accredited. So, but here's what I've sat on enough of those committees. Here's what I believe the class is thinking. I mean, the committee is thinking when they accept a student. Those people accepting you are humans, and they're going to have to spend 4 years with you in dental school, or 2 or 3 years. How long is the average ortho residency now?
3 years.
Yeah, they're going to have to spend your life with you for 3 years. And they've accepted people who they turned out they didn't like, they didn't want to be around, they were boring, they were whatever. And when they look at your application, if none of them could pick you out of a police lineup, you've already lost the game. You got to get by there and press the flesh and shake their hand. And you got to make them think, hey, if you were going to hang out with someone for 3 years, wouldn't you like to hang out with me? And,
right.
and if they see that you're enthusiastic, and they think, and if they open up your application and the first thing they do is smile. I mean, you're in a comedy club. I bet you smile all the time. By the way, how in trouble does your husband get when someone starts throwing out blonde jokes?
No, he does. Everything is fair game.
Everything's fair game. So,
yeah.
so you even laugh at the blonde jokes?
It's not a clean club. This is real. It's New York City. Anything can be said.
But does it offend you? Do blonde jokes offend you?
No.
No. You're just bulletproof.
I'm tougher than he is, probably.
And, another thing that I really love about you and what I've read about you is the fact that, everybody's always concerned about the richest people in the world. And I come from Kansas, and what bothers me, there's 8 billion people. So 1/3 has a smartphone like I do with an internet connection. 1/3 just has a cell phone with no internet connection. And 1/3 of all 8 billion humans don't have a cell phone or an internet connection. And everybody's worried about the intellectual property of Apple and all these other deals. And I'm like, why, and it was Teddy Roosevelt who said, I've traveled around this country many, many times. And what concerns me is that half the people are very, very poor and have nothing. And everything you read in the newspaper is about, things that affect rich people. And I love the fact that one of the first things you saw is that do-it-yourself ortho, it's going to bring more ortho to more people for a lower price. And if you got an idea and it's not going to be faster, easier, higher quality, lower price, and smaller and more convenient, I don't want to hear your idea. And I don't want to hear your lawyer concerns about intellectual property when 1 out of 3 earthlings doesn't even have a phone or an internet connection. I'm more worried about that kid in Kathmandu than I am about somebody's intellectual property rights. And where does this come from in you? Why were you excited that do-it-yourself could bring more ortho to more people for less money? Where does that come from?
Well, I think just in general, I live in New York City. So there's orthodontists that practice on Park Avenue or Fifth Avenue. If anyone knows, that's like a very expensive real estate, we'll say. And the cases that they do, they charge $12,000 for, or $13,000. And to me, that's not the place I want to be. I want to be treating the patient. I don't want to be at the place where I have to convince the person whose child, they're already paying for a lot of other things and they can't afford it. I want them to pay for it because the child needs it, not because it's like out of reach for them, right? So I see a lot of people that when my office is on the outskirts of New York City, like there's different boroughs. So I'm in Brooklyn. Brooklyn is not Manhattan, so I'm able to treat all different kinds of people, and my fees are not the same as they would be in Manhattan. That makes me feel more comfortable that people could come to me and be comfortable with what they're getting and what they're paying. I don't want them to feel that they're paying something that's not reasonable or something that they really can't afford when their kid really needs treatment. So the cases that I see through Candid sometimes are people that their parents never got them braces. They're now young. And like their chief complaint is like, I don't want to be embarrassed to smile. I need to go get a job. Like those are their chief complaints. So even if I can't make them, the perfect, case that I really would like to, if I could straighten those two front teeth and get them a job, I think that's a really nice thing to do. And that's more than I could say other people are doing. They think the orthodontists that think that the direct to consumer is like taking away from them. I think that's the wrong view. And maybe they're not really wanting for the patients what we should be wanting for them.
Yeah. And when I think of braces and the concern, I think that we should all pause and think about the patient a little bit, not how this is going to affect the orthodontist. I mean, you see it in cell phones. I mean, all the newspaper articles about iPhones and Samsung and all that, none of them had ever even mentioned the fact that 1 in every 3 humans on Earth doesn't even have a phone. You know what I mean? It's always, how will this affect Apple? And what will Tim Cook do? And will Warren Buffett buy the stock? I don't care if Warren Buffett buys stock. Why don't Warren Buffett buy a gosh darn cell phone for the 2 billion people that don't even have one? That's what he should be doing with his money. You're also saying that Candid has a new product called Candid Pro. And this is something general dentists would really benefit from. What are you talking about?
So Candid came out with a new product. It's called Candid Pro. It's clear aligners, just like they would offer their patient, like a small Invisalign. The only thing is that when they go through Candid Pro, they deliver clear aligners to the patients, or they give them that option as a treatment. But the treatment planning is done by the orthodontist, and dental monitoring, which is, you click your phone into this device that scans your teeth. That's also included in the treatment. So everything is taken care of by Candid, so that the general dentist could tell the patient they need, their teeth to be straight, or they recommend it. And then everything else is taken care of by Candid, including the treatment planning, which is done by orthodontists. So they don't have to worry about that, or what their, concerns could be, that like they don't feel comfortable with certain kinds of cases. They could depend on Candid to make that decision of what case should be treated and what shouldn't. So it's kind of like they don't have to really worry about that part of it, which I think is great for a general dentist that wants to deliver the service of clear aligners, but is concerned about, if they could do it.
Okay, I'm going to talk about something a little inappropriate, and that is the fact that most dentists will tell you, if you're alone with them in a comedy club having a beer, that it seems like all through school, if you had a problem with endo, doing a molar endo, the endodontist instructor would come over and help you. If you couldn't get out a tooth, the oral surgeon would run over and help you. If you couldn't get a kid to cooperate, the pediatric dentist run over and help you. And then you said, hey, I want to do an ortho case. And it was like, well, let's go learn about embryology and the growth and development of an embryo, and talk about cranial, facial, and it was just like of all the specialties, it was kind of like, that was a stop. And then you go to small town study clubs, and like go to a small town, like say, in Gaylord, Texas, in a study club. If you just do, half of your molar endos or whatever, the endodontist doesn't say anything, the oral surgeon doesn't say anything. But if you start doing an Invisalign case, now the orthodontist won't sit by you, and he won't talk to you, and he's upset. I mean, do you hear anything like that, or am I delusional?
Okay, so no, I think that first of all, there's one aspect of that you're bringing up, like in dental school, it's almost like you could almost do everything, but ortho is like separate, like everyone keeps it behind closed doors.
Right.
Which, by the way, trickles down to like other dentists treating us, maybe just me, I don't know, like almost like, oh, but you're an orthodontist. Like people still do that to this day. Like people I grew up with will be like, oh, but you're an orthodontist. And I'm like, I never put this in place. Like maybe you have that vision, but I didn't start it. So there is that idea, which I don't think is necessary. I think that this Candid Pro is kind of like the best in between, because I have general dentist friends that like to do Invisalign, but then like me to give their they like my feedback on it. They want like a little bit of guidance, because like you said, in dental school, they kind of didn't get much, right? Like we didn't really get that ortho training. But there is a fine line, like you said, when the general dentists start to do ortho, the orthodontists get upset. I mean, I don't personally, because some of those cases are the ones that you end up seeing, right? Like after they do it and then it doesn't fully go where they want it. But listen, if they want to try their hand in it, go ahead. You know, we don't have the keeps on it. We don't get to keep it all for ourselves. There's general dentists that do endo, like you said, and it's totally fine. And when it doesn't go well, then they send it to the endodontist.
I think one of the things that one of the things that hit home to me the most is you know, I was climbing Mount Kilimanjaro with 3 other dentists, and it was me a dentist, it was Eric from the school here, and one of his classmates, and then an oral surgeon. And the guy said to the oral surgeon, he goes, so are you a dentist? And he says, yeah. He says, we're all 4 dentists. And oral surgeons and endodontists, they always, if someone asks them, are you a dentist? They always say yes. But an orthodontist will always say, no, I am not a dentist. I'm an orthodontist. And I'm like, well, you have a degree that says you're a dentist. Is it fraudulent? Should we call a detective? Did you buy it on eBay? I mean, they go out of their way to say, well, no, I'm not a dentist. I'm an orthodontist.
I wonder if that's like generational. I'm just curious, because when people say, oh, I thought you were an orthodontist, I go, well, I'm a dentist first, and then I became an orthodontist. Like, I make it clear that I'm a dentist and I specialize in orthodontics. Like, that's what I do. I mean, to the point where my daughter said that she came home, that one of the girls in her class, it's like, your mom's an orthodontist, she's not a dentist. And she goes, but mommy, I made it clear. First you become a dentist and then you're an orthodontist. So you are a dentist. But
yeah.
You know what? It could be an old boys club where they wanted to be orthodontists. That's probably where it came from.
Oh my gosh, I'm trying to, oh my gosh, yeah, the Eric Harris, that K2 Adventures climb Mount Kilimanjaro, but that was so damn cool. It, in fact, made my whole day that the guy, that oral surgeon said, because I was wondering, you know, I just met him on the mountain, and the minute he told the guide right out of the gate, yeah, I'm a dentist, I thought, damn. That's going to be a fun oral surgeon. He just said he was a dentist. Do you, you know, the thing that I tell the kids the most is that, you know, I don't care if you're a C dentist, as long as you got an A in the diagnose treatment plan. You know, you want to learn how to diagnose and treatment plan. What's really, really bad is when you're an A dentist and you're getting an F on the diagnosis and treatment plan. You're doing excellent work that's not needed or in the wrong direction, all that kind of stuff. And I see it in pediatric dentists for the last 30 years. If 100 moms are motivated enough to search out a specialist in pediatric dentistry and take little Billy and Johnny, or in your case, your 3 kids, to the pediatric dentist, every one of them is going to ask, well, is little Billy going to need braces someday? And then their response was to write a slip, go down, make another appointment, meet another stranger. 60% of women work during the day, so they got to leave work. It's a big commotion. And now I see, you know, like Clear Choice, they said, well, we're going to take the implant surgeon, the restoring prosthodontist, and the lab tech, and we're going to put them all under a roof and make teeth in a day. And I call that 1 + 1 + 1 = 5. And now it was sold to Bob Fontana of Aspen bought it. But I see the growing trend now in pediatric dentistry is to get in there with an orthodontist. And in my backyard, if I see a pediatric dentist open by themselves and an orthodontist open by themselves, that's 1, and the other one's 1 + 1. But if a pediatric dentist and an orthodontist open, it's 1 + 1 = 3. It looks like they're growing faster, and I've already heard the moms say it several times. You know what? You should go here because they got the orthodontist right there. So it's all under one roof. That's what retail's all about, is putting it. When the first time I spoke in Australia, it was in 1990, and the dentist had to go out and get groceries, and we went to the butcher shop, then we went to the bread shop, and we went to 4 places to get groceries, and I'm like, damn, in America, that's all under one roof, and it was more fun to do it their way. But do you see the future of ortho dividing in between adult ortho and pediatric ortho, where orthodontists are going to go in with the pediatric dentist and do basically all kids under 18, and then the solo orthodontists are going to be more adult? Or do you even see this effect in New York City?
So I'll tell you, I do see some ortho pedo like offices together. I don't see a ton, but I see some. There's a few people do like the one-stop shop. They're in the same place. The one thing people don't like, which I understand, is that maybe they're selling it because the orthodontist's already there, which I don't like. Do you know what I'm saying? Like the moms will say, I don't know if they really needed it because the orthodontist is already in the office. I think they just pulled them in because I was there. So
Cynical. Cynicism. Cynical people, yeah. There's probably more of that in New York,
concerning.
Right? Cynical.
Yeah, I think that's concerning. Like, I wouldn't want people to think that I was coming to treat their kid just because I was already there in the office. So maybe that will decrease it. But I don't think it's such a bad idea. It's not such a bad thing in general.
So you were saying, I also was reading that you said that that Candid Co is a direct-to-consumer clear aligner company, but with orthodontists only doing the treatment planning, and that's what sets them apart. So is that still a deal? Are you guys the ones that only use an orthodontist to do this?
So far, we are. We're the only company that does that. So it's only orthodontists licensed in all the states that do the treatment planning. So I think that's a big difference. And it's all the orthodontists. I mean, we all know each other. They're all good people. They're not like, other companies have dentists that come and go. It's like, just come in and do the work, come in and do the work. This is really where we're part of the company. They want us to be part of it. And we feel like, we're all there together. Most of us have the same idea that we're doing this to benefit people that maybe wouldn't be able to get any kind of ortho treatment whatsoever.
Okay, well, I got to ask you a question about Candid Company because it's seriously, he's my favorite townie. He's, my God, he is just so damn cool. He's got, oh my God, how many posts does Ed have? He has, Dr. Ed has 23,914 posts. And on the thread about Candid Company says, Invisalign treatments were limited before the concept of bonding composite attachments with a printed template was developed. How can anyone expect a majority of success from any system that is based on impressions made by the patient and appliances that cannot utilize the advantages of bonded composite attachments? Now go easy on him because he's my favorite buddy on Dental Town. He's so damn smart. But what would you say to Dr. Ed? Okay, so I think that because the cases are not the most severe, that's the reason they don't need the attachments. It's not, and if there's a really high tooth, the patient's advised before, this tooth cannot be fully brought into occlusion because of our limitations. Is that the ideal treatment? Maybe not, but it is the patient's choice of whether that's important to them or not. So the not having attachments does limit the treatment, but that's the idea. It's limited treatment. Yeah. So and I got to ask you the question. I shouldn't ask this, but I got to ask you, it's extremism. It's in everywhere. My two oldest sisters are Catholic nuns. I mean, I could talk to them for 40 days and 40 nights and not even, you couldn't convert my sisters to be a Lutheran, let alone a Hindu or a Buddhist or, they're just fanatics. And there's a lot of dentist extremists that they tell their orthodontists, well, if you do that 4 bicuspid extraction and you dish their face and you do all that, I will never refer to you again. I'm like, so you're saying there's 8 billion people and no one needs 4 bicuspid extraction? And I had a patient whose dad played for the Arizona Cardinals. So he's like 6'6". His ab muscles, it looked like rope. Literally, you could stick a quarter in his ab and the quarter would stand up. And he married a little blonde girl that was about 5 foot. And we extracted 9 teeth to try to make this work because she had dad's teeth and mom's jaws. And when I told some of my friends about this, they said, well, I should have expanded the jaw. I should have done this. I did everything wrong. Will you please tell, you're an orthodontist, will you please tell my extremist homies that have no desire for any extraction that sometimes it absolutely has to happen?
Absolutely. An expansion is not, the goal of expansion is not really to gain space. Sometimes you gain space as a side effect of the expansion, but the expansion is really to change the skeletal growth that's not matching, right? Like there's a mismatch in the growth. When patients need extractions, it's because there's no room for the teeth. You could do all you want. You could spread them out, but is that going to be stable? I don't know. The cases that truly need extraction, they won't be stable if you do it otherwise. Those teeth will have gingival recession and all those other things. So there are times that you definitely need to extract.
And so when you look at the pushback of do-it-yourself orthodontists, Invisalign, anything that's not through the traditional channel, is it fair to say that it's kind of like 50-year-olds, 50 to 80, bad against it, no questions asked, and 40 to 25, open-minded listening? I mean, is all the pushback a bunch of old farts like me?
No, I think that's actually a mix. I think there's a mix of different pushback. The one, I think also dentists are also like skeptical of it, like the comments that I've seen about how you treat the patients. But I don't know why. I don't know why they get upset. Like, it's not like I'm taking away their cases or I'm doing something so severe. I mean, the patients are getting 12 aligners. It's not so significant what's being done. And we do encourage the patients to go get a scan from a studio, because you mentioned the impressions. The impressions are available, but it's not the ideal. The scans really are the best way to get the treatment done. But the pushback, it comes from all different. I think it's people who are not, I know this is bad to say, but maybe they're not confident in what they do. That's just an idea.
Also, I believe that clear aligners was simply the rebirth and the redo of lingual orthodontics. I mean, I've already seen this movie. They didn't want the braces to show, so we put them on the inside, and then their tongue would start playing with it. We called it the Curious George syndrome, and they would come in and they would turn their tongue to hamburger, and they would tell you, I can't quit licking the back of my lingual orthodontics. But so did clear aligners, was that the final nail in the coffin of lingual orthodontics, and now it's dead, buried, rest in peace?
I still see orthodontists that offer it. Like, I don't know if they actually do it or they just offer it on their websites. I don't do it. I do a lot of clear aligners, so I don't see a need for the lingual braces, but people offer it still. I don't know how often they do it. But they also say that they charge a real premium in order to do it, because it takes so much time and it's not easy.
When you, I also think it's extremist when orthodontists say they only use clear aligners. And I'm talking about some of my friends. I mean, Steven Reinhardt up in Montreal, love him to death. I think he's the greatest guy in the world. But I'm still going to tell him, and I told him on this podcast, you're still an extremist, even if you only do clear aligners. He doesn't do any traditional metal. But what I wanted to ask you about, we always see this question with implants, orthodontics, where some oral surgeons and periodontists are implant agnostic. They'll say, there's about 10 companies. You don't want the company to go out of business. You want them to have some research in case you get sued, yada, yada, yada. And they put up about 10 parameters of what my implant company needs to do. And a lot of people will meet that, Noble BioCare, Straumann, Neodent, all Implants Direct, whatever. Same thing with orthodontists. Some are very brand loyal. They say, I'm an Ormco man. And they'll show you their Ormco tattoo right on their arm, And others are like, I'm kind of agnostic. I mean, I've used 3 or 4 different bracket systems over my life. Are you bracket agnostic, or are you...
No.
drank the religion of Ormco, or what?
No.
How do you
I mean,
view that?
in residency, they tell, like, one of the faculty used to say, like, you've been given the tools, like, you have the skill to do whatever you need to do. Whatever kind of bracket you're handed, you should be able to do what you need to do. So I'll use whatever. I mean, I obviously have preferences, but I should be able to accomplish whatever I want to do with whatever bracket I'm handed. And I think that should be for all orthodontists. I know that there's a preference, but you should be able to use whatever brackets you're given.
So, the difference between, again, being out 32 years, I see dentists divorce their spouse, and that's not pretty and it's expensive. But it's a lot worse when they divorce their partner. And I figured it out over the years because, when you go home, you sleep 8 hours a night, you work 8 hours a day, whatever your spouse is doing annoying, you might not see all the time. But man, when you're working with a partner and they're doing something annoying, like, open contacts between fillings, and you're just seeing it all day, 8 hours a day, Monday through Friday. And I have a lot of friends that are in a small town. There's only one orthodontist. And every case they get back, they get triggered because the orthodontist never picked up the second molars. And I always say, well, you should go to marriage counseling and tell your orthodontist this or whatever. But it seems to be a big thing around the world that if you're really big into TMJ, of course, they all can't graduate from TMJ school without saying, well, the orthodontists, they destroy the bite, the curve of Wilson, the curve of Spee, they destroy everything. They're horrible people. They're just bad. Okay, but those people, I don't know. I'm thinking maybe they're 10 or 15% of all the dentists that have never given an orthodontist a single passing grade on occlusion from any case they've done. But I just want to hear from your thoughts. Do you or do you not pick up the second molars, and why?
Okay, so it really depends on the case. If the second molars are coming in nicely and they're in occlusion, I won't put the bracket on it. If they need to be aligned and if they need to be brought down, then I will. I guess that's more of a personal thing. We were always taught to bracket them right away. I find that my patients get really annoyed by the second molar brackets. They end up like digging in, the wire ends up poking. It's just comfort for the patient. But if they need to be aligned, then they go on. It's just simple as that.
Okay, and what's going through your amazing mind when you decide to glue a bracket on a first molar versus wrap it with a band?
Oh, it's more comfortable for just to have the bracket. And the band, just sometimes it ends up causing like a little bit of space at the end also. So again, comfort. The bracket's more comfortable.
And are you scanning all your ortho cases? And if so, what scanner are you using?
The iTero scanner.
So this is what's so obvious. iTero is owned by Align Technology, which owns Invisalign. Right. And so I always want to look at a dental student's first root canal because, if they get they stop like a 0.5 millimeter from the apex and they're a pulp lever and it's all clean and pretty, I say, okay, you need to go into bleaching, bonding, braces, clear liners. But if they're like me, if they're an apical barbarian and they throw a puff of sealer out the apex, I say, you're blood and guts. You need to do endo extractions. You're a bloody mess kind of guy. And what I've seen is if you are going down the pulp lever, bleaching, bonding, clear liner, they always get iTero. And if they're going down the blood and guts, they always go 3Shape out of Denmark, Copenhagen. Is that only because Align Technology owns Invisalign and iTero? Yeah. Or is there something about iTero that 3Shape doesn't do?
Because Invisalign doesn't accept 3Shape scans. That's why.
Which is an anti-competitive legal deal.
So at one point at a conference, everyone fell in love with the other scanner, and we thought Invisalign was going to be accepting it. And then they announced a month later, we're not accepting their scans. So that's really why we have to have the iTero. They make it the easiest. I
had Joe Hogan on the show, and I mean, you got to love Wall Street. They're aggressive. I mean, they're a little more aggressive than this Kansas down boy, but they'll do it. And then I want to tell you something. When I got out of school, and I don't even want to know when you were born because I don't want to find out that I graduated from dental school before you were even born. But I got out of school and no one ever mentioned sleep one time, or unless I was asleep in the class. And now sleep is everything. And they're
Huge.
mixing it all up with orthodontics too and all that kind of stuff. And a lot of the older people like me, some of them are saying, is this kind of, are you going overboard? I mean, now sleep, now I hear it cures male pattern baldness. I mean, if I just had the right CPAP machine, I'd have more hair than you. Has airway really taken over orthodontics? What percent of your cases are airway involvement? Does Candid and Co, does mild cases, does any of that have anything to do with sleep, or is sleep considered an advanced case, or talk sleep?
I don't think Candid Co touches upon it. The cases are too mild to go there. There is a lot of talk about, like, let's say expanders, opening airways, and the effects of opening airways on kids. Like when the kids have less airway, they have more ADHD, they have trouble focusing, they have trouble sleeping. I haven't gone that deep into studying it. I do think that the expanders do help with airways, though. So there are kids that come in and you could tell that they have trouble breathing, and those are the kids that need more airway.
And when you talk to an orthodontist, when they come back, when the parents come back, they say, a lot of times these young kids, they don't know what to say because the parents say, well, this isn't really a good time for us. We can't afford it. But he says it's really important to her health. So we got to get braces for little Jeannie's health. I mean, I don't want to be the mom that leaves my child unhealthy. And a lot of older people are saying, is it health or is it being as pretty as a peacock? I mean, I'm from Kansas. I mean, I've got uncles. I've got real live uncles that are edentulous that after their denture was relined for the third time, they threw it off the tractor, plowed over it, and they're 6 foot tall and they eat almonds and they're obese. And I'm like, okay, if I got a 6 foot uncle who's 50 pounds overweight and hasn't had a tooth in his mouth in 20 years, are you sure your daughter has to get braces or she won't be healthy? I mean, are people starving to death in New York because they had a crossbite and didn't get braces? How much of braces is beauty as a peacock to attract a mate, and how much is it is health?
Okay, so I'm not the orthodontist that says it's health. When the mom asks me, is my daughter going to be okay like this? I tell them honestly, they could live till 120 with these exact teeth and nothing could be wrong. They could be fine, but there's no way for me to know that tooth isn't going to get more gingival recession or things like that. But health-wise, they should be okay. There are those outlier cases that are surgical cases where then maybe health comes into play. But even then it's questionable. Like if the patient doesn't get orthodontic surgery, are they not going to be able to eat? No, they're probably still going to be able to eat, right? The wear that they're going to have on their TMJ, that could be a problem down the line, but they'll likely be healthy.
I'm Irish. I don't even use my teeth when I drink Jameson. I mean, I can just pour it right back. And then also another thing I want to, patient expectations was everything, because the one thing I want to point out to the young ones is that, they got a gap between their front tooth and you're trying to do clear aligners. You're trying to close their spaces. That's the easiest part of ortho. The hardest part of ortho is the damn retainer and the retention and their expectations. Some people will come back to an orthodontist 10 years later and say, well, your braces didn't even work. Look, that space opened back up. And I'm like, dude, when orthopedic surgeons redo knees and hips, they always say this will last as long as an American car, 5 years. Every 5 years, it's actually every 4 years and 6 months, the average American gets a new car, 13 cars a lifetime. Every patient I've had in Phoenix, they come back from their orthopedic surgeon, he says, yeah, he said it'd probably only last 5 years. And then they go back to their dentist with an implant that failed 12 years later, and they think it should last forever. They go back to their orthodontist, they say, well, you didn't even do your job, look at it. But would you agree that retainers and the patient's expectations of how long they'll stay straight is a more complex game than closing spaces initially?
Yeah, I would think so. I mean, even when I was younger, I wasn't told to wear a retainer for the rest of my life. It was like for this few months and then this few months. Now, I think if you ask any orthodontist, they say that when the patient asks, how long do you wear the retainer? They say, for as long as you want your teeth straight. So then it's up to the patient. When you decide that it's not important anymore, then you stop wearing your retainer. But until then, it's in their court, right? They have to wear them.
Right. So they'll wear the retainer and they'll have long hair until the marriage is over. And then they'll quit wearing the retainer and they'll cut all their hair off. I've seen this plan a million times. Hey, save my homies, the young ones, from getting into trouble. They're thinking about trying a clear aligner. They've been taking some courses in it. But some cases are just the absolute worst case scenario. What is it? Describe cases that the 1/4 of our viewers still in dental kindergarten school need to start understanding and looking at, saying, okay, there are people that play in the NFL, there are people that play college football, and you're in a high school pickup game, okay? You're playing tag football. What are the NFL cases that no dentist should even be looking at?
Oh, I don't really like to say that because, I mean, if they're skilled at it, do whatever they want.
It shouldn't be their first case. It shouldn't be their first case.
It shouldn't be their first case. Maybe like a severe class 2, severe class 2, even severe anything, severe crowding, because the treatment plans always look nice, but you have to know if that's actually realistic. Do you know what I'm saying? Like they could send it in and it comes back and looks beautiful. All the crowding's gone. But then you have to know if that's really possible. You can't rely on it 100% because a lot of times now the treatment plans are done by computers. There's no human behind it, right? So you don't know if that's reliable. That's just something they should know. There's no human behind a lot of the treatment plans. So they should be careful.
Okay. Dennis asking on Dental Town, if they're doing the Candid Co, can they also use those trays as a bleaching tray?
Yes.
Nice.
The answer is yes. They give, I think there's a package of like bleaching stuff that comes with it that they could purchase alongside that they could put into the aligners.
So Candid, what did you say? That Candid sells bleach with it?
Yeah, it's like an add-on package.
Huh. So is that on their website?
Yeah.
Products. So starter kit, clear aligners, retainers. What would it be under? Would it be under, or would it be under products?
Products, I would do.
And the products. Let me.
And they also teamed up with Philips, where when patients purchase like aligners, Philips has like Zoom whitening sets that they could get as well.
Okay. Yeah, I'm not finding the bleach product.
I mean, it might be once you become a patient.
Okay, let me.
Not like you can't buy it by itself.
Okay, but
you know what I'm saying?
Yeah, but you're definitely you can definitely do it.
You could do it with the treatment, yeah.
Because some dentists are wondering if there was enough space in between the retainer and the teeth to allow for the bleach.
Okay, so I get this question all the time. It's not the new kinds of bleaches are a little bit different. They're like more like foam. Remember there used to be like this gel that you use. So this is like much thinner. It's not the same kind of thing.
Okay. And then age. I mean, well, I don't know what to think of it because for a while there, I noticed all throughout, I opened up in 87 and all through the 80s and the 90s. I mean, I used to have little girls cry when I told them they didn't need braces because they wanted braces. It was the fad. They wanted the school colors of their rubber bands. And we actually had a couple of children, the orthodontist, so cool. he actually put some bands and brackets on or the front teeth or whatever, just so she wouldn't have a complete meltdown. And then the clear aligners came out because no one wanted to see braces, and I'm like, and when this Invisalign was coming out, I was specifically asking little kids, well, are braces cool? And they're like, yeah, and the mom would say yeah, and they always wanted the Desert Vista colors or the Mountain Vista colors and all this kind of stuff. So it was like totally cool, and then all these people are saying, well, you don't want anybody to know you have braces, and now during a pandemic, there's a mask on, and that's a good, I mean, it's so confusing. So my question is, if you were in grammar school, is it still cool to have metal braces and your school colors and matching rubber bands? Or are those kids wanting clear aligners so that no one knows they have braces?
So I guess it depends where you are. Like, are you in New York City? Are you in Kansas? So I don't know. Now the clear aligners are much more popular here. There are kids who still get braces and there are kids who still want colors. So it goes both ways, I would say. I would say 12 and up, they're starting to say they want the clear aligners, but the younger kids maybe want the braces. I have both. I have both kinds of patients, but the clear aligners are getting more popular in general. Like, I have young patients that ask for it.
So it's fashion is hard to predict, but they always say that fashion always repeats itself. So little kids always figure out that if something is really, really expensive,
Yeah.
you know, it's got to be more rare than something that's really, really
Yeah.
free.
And then TikTok, whatever's on TikTok. Did you know that Invisalign stock shot up? And one of the reasons was because Charlie D'Amelio on TikTok, who's like one of the biggest TikTok fans, was showing that she had Invisalign. And this was like known amongst everyone who watches TikTok. So there you go. That's cool.
So was that a good thing or not really a good thing?
I mean, that was a good thing for Invisalign or clear aligners. Every kid knew about them and they all want them because of it. So yeah. It depends. If you want clear aligners, then it's good. If you wanted your kid to get braces, then maybe not so good.
Yeah. So I can't believe we went over an hour. I mean, I just feel like I could talk to you for 40 days and 40 nights. Was there anything that you were thinking that we were going to talk about that I did not bring up and you wish I would have brought up?
No, I think we touched on everything. I did like the female part, like all those girls that want to go into orthodontics or dentistry. I say go for it.
Well, it's really wild. When I was back in the day, dentistry was mostly a male profession. Mm-hmm. And you go around the world now, and now most of the classes have more females than males. Mm-hmm. And I'm taking, I always want to look at the whole unit, like where is this starting and where is it ending? And then I can figure out where I'm at. But when I was little, all the OBGYNs were males. And if you told him you had a problem and he couldn't find it, he said you were being hysterical, which is really rude considering Greek hysteris is a Greek word for your uterus, and he's calling, they're like saying, my arm hurts. Oh, you're an armistice. I mean, mm-hmm. And now all those OBGYNs are women. And mm-hmm. I said it, I've been saying it for 10 years. I can't tell you how many times I've gone to a pediatric residency program, and they had 6 students, and they're all girls, or it's 5 girls and 1 boy. And I'm telling you, I think it's biology because I raised 4 boys. Everything's cool. Until they fell down and got a boo and started crying, and they'd run all the way around me to get to mom. And then I see that that when women who take the majority of kids to the dentist, I mean, my God, when my patients, when a man checks out with his kids, and I'll say, oh, when was your kid's birthday? I'm filling out the insurance form. When was his birthday? I have no idea. And you're like, well, was there a pumpkin on the porch, or was there a Christmas tree, or do you remember anything about your child's birth? And he's like, well, I know he was conceived in the back of a Ford 150, but I have no idea when he actually came out 9 months later. It just seems like women are the majority of the care children making the appointments for their children, for their husband, for everything. In fact, if you're a male and you're over 65 and your wife dies, half the men die in a year. And the most weighted observation for the half that didn't die within a year is they remarry one of their wife's widow friends. I mean, men are basically they're kind of helpless, and I just see that another thing that I've seen in real life, and other consultants have told me, a man tells a woman, "You need 3 cavities. You have 3 cavities. You need 3 fillings." She says, "Okay." Woman says, "Woman does. You have 3 cavities." "Well, can you show me on the x-ray?" "Well, what happens if I don't get them filled?" "Well, do I have to have a filling? Can I have a crown? Can it be white?" I mean, I don't know how men, I think the only way men can compete against women doctors of any kind is to start a company and hire them. I mean, if you don't hire them and you're just going to compete with them head on across the street, I don't think a nurturing, loving, caring, I mean, look at dentistry. I mean, when people say dentistry is going the way of Walgreens, I mean, go to France. When you go to France and you get a prescription, the doctor loads it on a smart card, and then you go find an ATM machine that's made here in Scottsdale, Arizona, and you slide in your insurance card, and a bottle comes down, the pills come down, a label comes out. You don't need a pharmacist at Walgreens or CVC. But when you come into dentistry, I'm going to tell you, I'm going to sell the invisible. I'm going to tell you have 4 cavities. You're going to have to believe me. Well, who would you trust more? A man with a tie or a woman? Who is more likely to lie? A man with a tie. Men only wear ties to keep the foreskin from coming up over their head, and they're always trying to sell you something, and the women are just more honest. The used car study, University of Chicago has more Nobel Prize winners in economics than any university on earth, and right in Chicago, so many of those males, couldn't believe it, they would take male econ grad students and women and go to all the car shops around Chicago, and guess who got quoted the higher price for a car every single time?
The woman.
The woman. I mean, I think when you're selling the invisible, you're going to trust a woman. She's less likely to hurt you. You can ask her, more likely to ask a stupid question, and she'll give you an honest answer. I think women are going to take over healthcare. They've already taken over OBGYN, gynecology. They're on a fast track to taking over pediatric dentistry. Do you see that trend too, or not really?
Yeah, I think it's gotten much better. I mean, at the beginning, I mean, I'm not that old, so it's not so long ago. But when I just started my residency, they realized I had a baby, which I obviously didn't tell them because you don't have to say that when you're being interviewed for a residency program. And the director pulled me aside to say, "We just want to let you know that when you're here because we heard you have a baby at home." And my response to him was, "I had that baby in dental school and I still graduated top of my class, so I'll be fine." That wouldn't happen right now. Like, that wasn't so long ago that someone said that to me as a female. He didn't say that to any of the males in the program that had children at home. But things are changing. If someone would have said that today, they would have gotten in big trouble, right? This is only like 9 years ago. So I think we're going in a really good direction for women. I think things are getting much better.
I would have said, can you speak a little louder into the microphone? Yes, a little louder. I'm trying to get free tuition. My father's a lawyer, by the way, so can you give an example of this? But yeah, sexism is tough, and the one thing I don't like about sexism in the United States is Americans are really competitive. They're really hard on themselves. That's really, really good. But my God, I've lectured in 50 countries, and some of those countries, it's at a whole nother level. I mean, it's at a whole nother level. And I mean, but where I'm really excited is I've lectured in many of these countries, and then afterwards we go back to the doctor's home, and as soon as they go through the door, you know, the saris come off, the veils come off, they're dressed like you, the Rolling Stones come on, the cabinets have Smirnoff vodka, and everything's fine. And then you sit down and you talk to that female dentist, and you say, "Well, so what's going on?" And they go, "Well, it's just the 70, 80, 90 years old. And as soon as that generation passes, and then you come back here, well, my God, look what all the 80-year-old televangelists in America are saying on TV. It's just exactly as crazy So they're all equally crazy. I don't think any religion has a monopoly on craziness, and it's just a generational gap. And the old people will eventually move on, and then they'll be replaced by normal people like you. And but hey, thank you for having an open mind. Thank you for coming on the show. It's hard to get a busy New York City orthodontist convention. My final question is,
Sure, go.
can we have an update on COVID-19 in New York City? And when will that city come back to life?
Okay, so it's coming back slowly here. One big update, which you're not going to like, is comedy is still illegal. It's illegal.
Still banned.
Yeah. So that hasn't come back yet, but people are coming back. I mean, I'm hopeful.
So I got to tell you my New York City deal. It was August 4th, 1990. I decided I was going to be a lecturer. And I was going to, I was born and raised in Wichita, Kansas, never been to New York City. It's the biggest city in the country. And by God, I mailed all the dentists in New York City a flyer. And I gave a lecture at the Sheraton in Manhattan, August 4th, 1990. My classmate, like 2 days before, called me up from dental school, Craig Stike. He says, "Are you really going to do this?" And I said, I'm going to do it. He goes, "Dude, they're going to eat you alive. You're from Kansas. You're going to New York City."
No.
He goes, "Dude, I'm going with you. I'm going to be your backup." So Craig Stike and I, this is how hillbilly we were. We fly into JFK. I can still remember like yesterday. I was, grew up where the tallest thing is a grain silo. And I'm looking out the window and all of a sudden I start looking at this. It was like an inverted Grand Canyon. And it finally dawned on me. That was the skyline. It took my breath away, and I couldn't believe it. So then we landed, and we were so hillbilly. It was August 4th, 1990. I was born in 1962, so I was 28. And my gosh, it was before my 20s, so I was 27. And he said, "Where are we going, gentlemen?" And I said, "The Sheraton in Manhattan." And he's like, "And which one?" And I'm like, "Oh, man, there's two?" There's two. So I got to call my ground crew like, "Hey, there's more than one Sheraton in Manhattan." This cab driver's like, "Dude, there's like 50 of them."
Yeah.
And I went there, and I'll never forget. And another speaker, it was Rick Kushner, who owns 300 Comfort Dentals, called me at my home, and he goes, "Yeah, I've been lecturing for a long time, and me and Cindy saw that you're giving a lecture, and your first one's in New York City, and I just want to tell you that that's a really bad idea. You need to go to like Nebraska or Oklahoma or Iowa, someplace where they'll really be really nice, but they're going to eat you alive." And I said, I don't care. I just want to see New York City. Those were the nicest, 20th guys I'd ever met in my life. They were all old. They all only came out of morbid curiosity. No one even cared what I said. They were all probably like 50, 60, and they just sat there. And then when it was over, every one of them invited me. "Well, my wife's cooking Italian tonight. Come with me. We'll have red wine. We'll have that." And oh my God, I just love New York. And one final last question. I swear to God, I'll let you go. So what was the uproar about the governor and a CNN reporter, the Kumo brothers? That was a thing. The CNN, I guess the governor has a brother on CNN.
Oh, yes. You don't know that they're brothers?
Well, I've been reading it that there's a talk show on CNN and the governor and their brothers and sisters.
Sometimes they go at each other. Like he makes fun of his brother, but
the article was implying that it was journalistic, not integrity, because basically you're not going to ask your brother the tough question. You'll go easy.
I guess that's kind of true, except for at the beginning, he was going after him. But maybe that was fake. I think there is something true to that. You can't really interview your brother.
Huh. And my brother,
I
have one brother. He's Paul. He lives in Sydney, Australia. And I just want to shout out to my brother, Paul, that I don't care what you say, Paul, I am Mom's favorite son. And on that note, Paul's got to know it's true, right? Right? And to say it's not true, if you go to my mom's Facebook page, she has a picture of my damn brother and not me right on her Facebook page. But that's only because my brother made the Facebook page. But Billie, Rachel, Zoldan, DDS, thank you so much for coming on the show. It was an absolute honor to podcast you. Have a great day.
Thank you. Bye.